Something that many new students are intimidated by is Spanish pronunciation. Perhaps short words like hola, adios, gracias. These may seem comfortable enough, but then we add just a little bit more, like so, and then maybe we start having some doubts. And now we have a J here in this word, and then there's a C in that word. So now we're seeing consonants that may differ from the way that we use them in English. And so we see a word like this, and we may wonder, when is this sound a soft C? Or when would it have a hard C sound? And now there's an X in that word. And honestly, if the word is an X-ray, then I'm not even 100% confident I'm using it correctly in English. So what do we do with all of that? How can we start pronouncing Spanish words better today, and in the process begin to feel more confident speaking the language? Well, I'm Josh. I'm a former Spanish teacher, now physical therapist assistant, and I created an in-person Spanish course designed specifically for PTs and OTs. And now I'm turning that course into an online format. And if you consider yourself a beginner and are a PT or OT, or even work in healthcare and are interested in improving your Spanish, then this channel is for you. Let's talk about pronunciation and what you can do to start improving your pronunciation and feel more confident speaking Spanish. One of the most important things that you can do, that is also one of the most straightforward, is learning how to pronounce Spanish vowels. And thankfully, we have two things going for us with vowels. The first, Spanish vowels sound very similar to our English vowels. And the second, Spanish vowels stay consistent with their sound. For example, in English, the letter A can sound one way, like in the word ate, and another way, like in the word father. But in Spanish, the letter A will always have only one sound, a. So, let's talk about vowels. In English, we tend to elongate the sounds of vowels, but in Spanish, we want to shorten them and make it more succinct. Let's review some words and listen to the difference to see what I'm talking about. The letter A, or A. Let's take the word banana in English. In some Spanish-speaking countries, you would say banana. So notice how with the same word in English, we tend to elongate the sound of the word, banana. But in Spanish, it's shorter and more succinct, banana. Or another word, Canada. Notice again the elongated sound in English, Canada. But in Spanish, you would say Canada. Do you hear the difference? Banana, banana. Canada, Canada. The letter E, or E. A good example for this vowel would be the Spanish word for baby, bebé. With a more anglicized sound, it may sound more like bebe. But to sound more Spanish, you want to say bebé. All right, now let's try a few others. Salad, ensalada. Right, derecho. Versus saying it as ensalada, derecho. So do your best to keep the vowel sounds shorter so that when you speak, you sound less like ensalada, derecho, and sound closer to ensalada, derecho. The letter I or I. Some good examples of this vowel would be the word for yes, sí. Not sí, but sí. A few other examples would be image, imagen, impossible, imposible, belt, cintura. The letter O or O. This vowel sounds very similar to the English O, just quicker and with a bit more punch. A few good examples of words that use this vowel are pretty, bonito, ankle, tobillo, observe, observar, and mouth, boca. The letter U or U. This vowel rhymes with the word boo, but again, also a little bit quicker. Some good examples that use this letter are group, grupo, last, último, urgent, urgente, urology, urología. So, we've got our basic sounds for each vowel. And if you learn nothing else about Spanish pronunciation, learn at least the sounds of the Spanish vowels. This is a big step that you can take to really improve your pronunciation, and it will be much easier for your patients to understand you. All right, let's review so you have this down. A is a, like in the sound we make in the word hot. E is e, like the sound in the word let. I is I, like in the sound in the word see. O is o, like in the word no. And U is U, like the sound in the word boo. In future lessons, we'll go over the most common vocabulary words that you'll use as a PT or OT in your work setting. And as we start to do that review, we'll really be able to apply these pronunciation rules. And look, a final word of advice. Be kind to yourself. I think there's a lot of teachers out there who push the goal of sounding like a native Spanish speaker. And I think that's an unrealistic goal. And it ignores where you are in your Spanish journey. You are, presumably, a native English speaker. Your understanding of pronunciation comes from that. And rightfully, you should and will have an accent. So embrace it. It's a part of you. Our goal here will be to help you to improve your Spanish so that native Spanish speakers can understand you and that you can understand them. Don't overthink pronunciation. We can get so lost in wanting to sound perfect, and then we end up talking ourselves out of using Spanish because we're not good enough. But remember, you are not a native Spanish speaker, and neither am I. Our accents are a part of who we are, and you should feel good embracing that as well. Your native accent will always be a part of your Spanish, and that's a good thing. But by applying these rules, we can make our Spanish more easily understood, and in the process, feel more confident when speaking to others in Spanish. Review these rules if you need to, and then start practicing. Coming up next, we'll look over some of the consonants that can challenge us. I'll see you there.